The purpose of our study was to evaluate at the national level the impact of insurance status on the local presentation, use of cancer-directed therapy, and outcomes among patients with head and neck cancer in the United States. So our primary data source was the National Cancer Institute Survival Epidemiology and End Results Database, the SEER database, which is a national cancer registry encompassing about 25% of the United States. We had queried between the years 2007 and 2012 for primary squamous cell carcinomas of the oral cavity, pharynx, and larynx, returning a final sample size just under 54,000 patients. The majority of patients were insured, with about 15% of patients having Medicaid insurance and about 5% of patients having uninsured status. Overall, the most common subsite was oral cavity, followed by larynx, then pharynx. And when looking at the insurance groups, both the Medicaid and the uninsured patients had similar clinical and demographic information. So relative to their insured counterparts, they're more likely to be younger, to be unmarried, to be of minority race, and to reside in counties with low income or education statistics. With regard to HNSCC stage of presentation, patients with insured status were more likely to present with early stage 1 or 2 disease relative to uninsured and Medicaid patients. So approximately 40% of the time they presented with stage 1 or 2 disease, compared to about a quarter of the time with Medicaid and uninsured patients. Insured patients were more likely to present with T1 primaries, node-negative NACs, and to be less likely to present with distant metastatic disease. Next, we evaluated between the association of insurance status and cancer-directed therapy. So we looked at the receipt of cancer-directed surgery, defined as greater than or equal to a wide local excision, and the use of external beam radiation therapy during the first course of treatment. What we found in multivariable analyses after adjustment for clinical and demographic information was that patients with uninsured and Medicaid status were significantly less likely to undergo external beam radiation therapy, about 20% for Medicaid and about 30% less likely for uninsured patients. On the other hand, for surgery, only uninsured patients were significantly less likely to undergo surgery compared to insured patients. In other words, Medicaid patients underwent surgery at similar rates to insured patients. The final aspect we evaluated were overall and cancer-specific survival. So overall, patients with Medicaid and uninsured status fared worse with regard to overall and cancer-specific survival relative to their insured peers. One of the most surprising findings of the studies was that patients with Medicaid status and uninsured status had identical survival curves with regard to cancer-specific survival. So no significant difference between those two groups, yet both fared worse compared to insured patients.